Welcome everyone to our first committee meetings, Wednesday, January 8th, 2025. We have Legislator Lucas, it looks like, on Zoom, and Michael Ryan on Zoom. Start off with Health Services Committee.
It wasn't in that order. Opening up Health Services Committee meeting at 6 p.m. We'll right into our resolutions. Laura said she had nothing to say to us tonight. Authorizing agreement with the Greene County Community Services Board and Credible Mind, Inc. and budget amendment. Drew. Davis. All in favor?
Aye.
Opposed? That's carried. Authorizing agreement, Greene County Mental Health Community Services Board and the Mental Health Association of Columbia and Greene Counties, Inc. and budget amendment.
Davis.
True. All in favor?
Aye.
Opposed? That's carried. Authorizing agreement, Greene County Mental Health, CSB, and Northeast Parent and Child Society and budget amendment. Davis, Handel. All in favor?
Aye.
Opposed? That's carried. Authorizing agreement, Greene County Mental Health Center with the State University of New York, University at Albany. Davis, Handel. All in favor?
Aye.
Opposed? That's carried. Approving individual provider contract preschool special education program. Drew.
Davis.
Davis Langer. All in favor?
Aye.
Opposed? That's carried.
Patty, I just have a quick question for Laura. Laura, is there a website or anything that can tell parents how effective these schools are that are getting sent these kids with disabilities? See how they're doing?
My knowledge of this is that the school districts have to do these reports every so often, and that's where the information sits. When the school districts do that, we can get it. We don't collect that data. It's the responsibility of the school districts.
And the state doesn't either. It's the school district. Okay. All right. Thank you. Thank you, Patty.
Related service provider contract preschool special education program. Handel.
Davis.
All in favor?
Aye.
Opposed? Carried. Accepting minutes, Medical Professional Advisory Committee, Utilization Review Committee, January, February, and March, quarter 1, 2024.
True.
Davis. All in favor?
Aye.
Opposed? That's carried. Accepting minutes, Medical Professional Advisory Committee, Utilization Review Committee, April, May, and June, quarter 2, 2024. Davis. All in favor?
Aye.
Opposed? That's carried. Appointing member, Greene County Emergency Medical Systems, Inc., EMS, Board of Directors.
Lavera.
Lennon, Handel, Linger.
James.
Entire committee.
Sure. Abstain.
Okay. Budget amendment, Greene County Public Health Department Performance Incentive Initiative Award Year 12. Linger.
Davis.
All in favor?
Aye.
Opposed? That's carried. Okay, is there anything else to come before?
Chairman Handel, if I might take a minute to answer, hopefully partially answer Mike's question. I was involved probably like 25 years ago with preschool special education. I was a parent advocate volunteer. And periodically there are evaluations between the parents, the school district, and a lot of times you have the actual practitioner that's working with the child. So, the parents do get a chance to meet that person and they'll discuss the different types of therapy their child will get. So even though it's not a website, the parents will be able to meet and evaluate the therapist that is working with the child.
Thanks.
Is that only after the child is appointed that?
No, well, actually, you can, they call it evaluation. It's not really an evaluation. It's a meeting. They're usually staff from the school, the different organizations that meet the therapists. There's usually people from the county there. There's usually a parent advocate volunteer with somebody who has a child in the system who's there to, talk to the parents. Parents don't feel their child is getting what they need, or they don't understand it, or they want to talk to somebody whose child is in the system. So that'll happen right there.
I had a similar thing. As long as you put it in writing, the school has to do the evaluation. So, they don't just do it arbitrarily. So if you think there's a problem, and you want it done, you have to put it in writing, plus the school to do an evaluation.
And Patty, just, I mean, I can only speak for Catskill Central School District, but, I have a child with disabilities, so the district actually places the child based on the disability. So I have a child with physical disabilities, not, cognitive, so it's very difficult to place children without the cognitive disabilities tend to go down to Kingston, or they'll go to Albany to the CP Center, but children that have physical disabilities, it's very limited. So I know at the point we were at preschool age, he ended up having to go to Ravenna, so driving from Kiskatone to Ravenna each way at 3 years old. So again, the options are very limited, and they have to fall within a scope that they can offer the array of services that, and that comes to the specialty providers like OT, PT.
Is there anything else before Health Services Committee this evening?
Oh, this report here that's at the end, when was this?
The report was
Put out.
just created by a public health epidemiology fellow working with us, and he presented it during our medical professional advisory committee. And I shared it with you to see if you had questions or had any follow-up that you'd like.
Well, it was very informative. I just wanted to know, like, when did we get it?
Yeah, and he just recently presented it at our December MPAC meeting, and the decision was made to Sean to share. The data is not that new, but it's the most recent data that we have. And there's some good news in there. The overdoses are going down, but there are also some significant concerns. And one question I wanted you guys maybe to bring to the EMS council is, did you notice the heart attack mortality rate went up significantly? And so I thought that was something to consider as you guys are looking at the centralized or potentially a new way of doing that.
And the breast cancer, I noticed
Significantly higher than you're
Davis?
Senator Davis, we are closed.
Thank you.
Thank you, Tammy. I'd like to call resources to 6:09. We have 3 action items before us this evening. Well, let's get right into it. First one is approving recommendations for including land into agricultural district 124 and declaring negative secra declaration. I need a motion.
Or
True and Hobart. Any discussion on this? All in favor?
Aye.
Opposed? So carried. Number 2, amending resolution 460-24, authorizing Greene County Cultural Fund contracts. I need a motion on that. Linger? True. True will second. Any discussion on that one? All in favor?
Aye.
Opposed? So carried. Third and last, appointing member for our Columbia Green Workforce Development Board. I'll need a motion on that. Dorrington, Buelich will second that. Any discussion? All in favor?
Aye.
Opposed? So carried. That's the end of our resolutions. Does anybody have anything to,
Chairman, if I may,
sure?
have you, has there been any, motion to create a search committee for the power presidency?
As of yet, no. But I think it's gonna happen real soon. Probably, their board of trustee meetings will be coming up, I think, this week. So, yeah,
6 months is not a long time.
yeah. I'd be curious to see if their provost there, the lady's interested in it. Victoria? Victoria.
Victoria said, okay.
I'd be curious to see. She seems to be pretty knowledgeable there, so maybe they may find something in-house. Who knows on that
Well,
side.
I'm afraid of the vacancy, but,
Who knows? Maybe they can do
Ah,
jobs
yeah.
for one person. You never know. But as of yet, no. Because yeah, she's done June,
Yeah, for the
Carly.
school year right now.
right? So, all right. Anything else?
Motion to close.
We have Lennon and Dorrington. You're closed.
Safety committee to order at 6:12. Dan, would you like to start?
Good evening. So for December, the 911 center handled 608 EMS calls, 165 fire calls, 1,540 police calls, and 578 on the other category. We took 3,002 inbound phone calls. There were 91 mutual aid EMS events and 5 fire mutual aid events. Now, throughout the whole year, we get up here and tell you the hazmat team did nothing that month, but they made up for it in December. So they did 4 calls in December, 1 in Catskill, 2 in Coxsackie, and 1 in Greenville. We just have 3 items on the agenda tonight. One is authorization for out-of-state travel for the Tyler Tech Conference for our 911 Systems Administrator. Tyler is the system that we use for the CAD, and we'll be integrating additional things in 25 to give us enhanced text to 911, as well as the video to 911 functions. We're appointing a couple new members to the Fire Advisory Board, and then initiating the debris management plan. We know I've talked about many times. We have a number of different plans that we're doing. Some of that are in process, and a few more to do with debris management. All I got. Any questions?
Thank you. Thanks, Dan. Sure.
Evening, everybody. For the month of December, we had 34 civil attempts, 17 civil papers served, issued 171 traffic tickets, investigated 32 traffic accidents, made 33 arrests and 5 DWI arrests. We handled 496 calls for service, made 387 traffic stops, and issued 2 Narcan kits. On December 1st, the starting jail population was 32. As of December 31st, it was 34. The high for the month being 42. Corrections officers did 24 transports, traveling 860 miles, building 44 and 44.15 hours, moving 32 inmates. We have no state-ready inmates in our custody. We brought 4 families this year to participate in our annual Christmas Shop with a Cop event at Walmart. And we also had over 200 kids come to our Christmas with the Santa event at the office. We did have an illegal alien assault, stab someone in the village of Catskill. He was charged with assault second and committed to the jail. It turns out I was advised that he had 9 arrests in New York City, as well as he was being held here on an assault second charge. ICE had already deported him on one occasion, and they were very quick to obtain a warrant and come and pick him up and remove him. So, good. That was a good one. We're entering into a program with the New York State Sheriff's Association called the Blue Envelope Program. It's basically for drivers with autism. Because oftentimes they're not capable of dealing with the police when they're in that type of situation. And we'll be rolling that out next month. Basically, they have an envelope. It gives them instructions if they can hand the police officer and tell the police officer what they're dealing with. So trying to pair with the services Greene County will help us roll that out. You do have one resolution that you have before you tonight for a new K-9 to replace K-9 Haas, which will be retired at the end of the year. There was an opening in the explosives detection class starting this month in Albany that we were fortunate enough to get at no cost whatsoever. And we were able to get a good price on the K-9 from a reputable breeder that we have used in the past. I do want to take a second to thank Legislator Hobart for the great work he did as chairman of the Public Safety Committee for the last 5 years. Tommy certainly has helped us go forward, giving us the ability to continue to keep the county safe. Thank you, Tommy. And it's also been a pleasure to have the ability to communicate with each of you, and I look forward to working with you all for the next 3 years.
Thank you, Sheriff.
How old is Pop?
Hans? But he's old. His certification will expire, maybe 10, but his certification will expire at the end of 25.
Okay, and then the resolution before us tonight. I get it, is it the money funnel that's gonna pass through money towards this schooling or?
No, the schooling is free. We got that at no cost because they had an opening in Albany, and Kenny Stern is running it.
Okay, with the explosives specific.
The explosives.
Dual purpose dog or?
It is a dual, it will be a dual purpose, but the tracking school will not start till middle of summer. So by that.
Chairman, should we change or amend the resolution so it's dual purpose, not just specific to one purpose of the dog?
For the purpose of the dog, I think if it matters, we can. I don't know if it matters for the purpose of the dog. It's really up to the sheriff what he wants to use the dog for.
They're not training it.
Yeah, as far as we're concerned, you were going to buy the dog or you don't buy the dog.
I mean, the dog is gonna do whatever discipline it's trained in.
Hopefully, correct.
That's the goal.
Yeah, we would buy, even just related to the sheriff, we would buy a patrol car or an SRO. Or would we buy it because it's for an SRO or?
Well, I was just asking for the funnel of money. So if there's funding coming through, if there has to be a specific label on this canine in order to get it, or do we change or amend the resolution so it's dual purpose? So if the dog, that's all, not buying a tucker, that's all I'm saying.
Well, the funding for this is actually coming out of our drug seizure fund, so it's money that was, what we seized, it's not.
Just that
Sharon, question. Just regarding the assault second stabbing in Catskill with the illegal alien, how is ICE notified? Do we have a 287G program established at the jailhouse?
We do not participate currently in 287G program. There's only one sheriff's office in the state that participates in that, so that's the way actually. Not that we wouldn't look into it, depending on the circumstances. So. But that was a Catskill PD case, just so you know. So they contacted us. We held them. Right. I'm in charge of the law.
Yeah,
And they came with the warrant, so.
I'm just looking at ways for us to be proactive, as they're coming in. So,
Yeah.
this
I believe
person
he had
had,
9 other.
right,
He said before he got here.
right. So somehow we got through other municipalities in their jail. So if these guys, people are coming into our jail, if we're able to, notify ICE on the 287G.
Yeah, well, 287.
Yeah, that's not.
You're basically deputy.
Well, there's there's a section just for jailhouse that.
Yeah, there's two, right, there's field officers and jail. The Rensselaer County Jail is on the tour, so that's the only jail. So after the change of administration, to a certain.
Congress just passed the Lake and Riley Act yesterday, so hopefully that'll get some.
Yeah, no, we would absolutely contact them. We have not, yeah.
Yeah, we have not declared a sanctuary county.
A certain group would like us.
Yeah, we have not, but I'll do that.
I'll leave that.
Thank you, Cheryl.
Thank you,
Sheriff?
Sheriff. Al?
Congratulations to the legislature. I am Alan Frisbee, the probation director. I'm in my 18th year as director and my 44th year as a member of the department. And yes, on more than one occasion, Mr. Groden has questioned my sanity as to why I'm still around, but not planning on running away yet, Sean. The probation department is staffed with a total of 12 persons, 2 professional and 2 probation assistants. On the professional side, we have the director, 2 probation supervisors, 3 senior probation officers, and 4 probation officers. We have an aging staff. 3 of the 10 are at least 60, 4 of the 10 on top of the 3 are at least 50. We have nobody younger than 44. That's an officer. So we're getting up there. We haven't had any new probation officer hires since 2017. For a numbers run, and all our probation officers are sworn peace officers and all our. For a numbers run as of December 31st, we have 112 felony offenders and 129 misdemeanor offenders for a total of 241. The year prior to that, it was 107 felons and 116 misdemeanors, so we're up 18 persons over that period of time. Out of the 241, there are 9 absconders, 5 were misdemeanors and 4 felonies. We have 7 current global positioning system GPS bracelets in place for pretrial cases that cost the county $4.45 a day. We have 1 transdermal alcohol device in use at $9 a day and 1 remote breath at $8 a day. On the juvenile side, 4 juvenile delinquency independent cases, which is the initial stage of the process. 4 juvenile delinquencies in a pre-adjudicatory status, which means they've gone to court but have not yet been adjudicated, and 1 in a person in need of supervision status, or a total of 5 in the pre-adjudicatory. And there are 6 adjudicated juvenile delinquents and 1 person in need of supervision. So we have a total of 16 juveniles under supervision right now, which is the same number as a year ago when we slightly adjusted this to order. So like that, this question.
I think we have the, moving on to proposed action items. Number 1, authorizing out-of-state travel for Ed Hilger, emergency services. Sorry, Handle over, Hobart. All in favor?
Aye.
Opposed? That's carried. Number 2, amending resolution number 488-24, appointing member of the Greene County Fire Advisory Board. Martinez and Hobart. And Lennon. All in favor?
Aye.
Opposed? That's carried. Number 3, budget amendment and authorizing creation of debris management plan.
Handle.
Lanudo, Handle? All in favor?
Can I just ask a question before we vote on that? What did we have before, this creation of debris management plan? What did we have in place before this? So what did we do if there was storm with the debris?
So the last time we had a significant event was Hurricane Irene, and we did it ad hoc.
We have just an emergency management plan. It wasn't specified in the debris removal.
So this plan called out, we pre-identified locations for debris as well as, say, white good metal and other things. It lays out the methods where as debris is picked up, how it gets weighed or visualized. We bring in outside contractors, right? We have to track all of that. So it lays out the plan and the template. We're doing it when we have to do it. So we don't have to create it.
Just seems $25,000 is a lot of money to spend on a plan that we've already been doing, and we have competent staff that could probably write it for us. Thank you. Dan, John, Scott, they're all directors.
I'm sure any of them are.
Well, something's in place right now. That's my only point. It just seems like $25,000 to write a plan seems like a waste.
And I will tell you, after Irene, the town of Bradsville did everything. We had to take everyone through FEMA. It all went to the landfill, but that was by a private contractor. Like you said, I don't think there was any plan in place. I think the county did come up with dumpsters for steel, some of it. But other than that, all our debris pile all went to Seneca Falls by a private contractor. And that was a large pile of debris.
Yeah.
But even if we have a plan that tells us how to separate it and stack it, we're still paying contractors to take it somewhere, right?
Great.
So it doesn't matter if you have a pile of metal here, house debris there and there, we can do that on our own without paying the contractors either way. $25,000, my opinion.
Dan, how is this to be funded? Was there grant money for this, or is this already,
No,
like, where's this
coming out
money
of our
from?
fund balance.
So, well, yes and no out of fund balance. So this comes out of the LEPC fund. So the Local Emergency Planning Committee, which exists for exactly that, the emergency plans. For a long time, we got the blanket, $2,000 a year to go to this committee. All we did was we just kept stockpiling it down here. The committee itself never spent it on anything. We utilized other grant sources for other plans. And just trying to maximize our dollars to get as much done as we can. We wanted to use the existing money sitting in this LEPC fund to fund this particular plan. It falls under the category of what we can do. If we get audited on these funds at any point from the state, we have to be able to show what it paid for. So we get, it's not really an audit, they call it fiscal monitor review. They come in every few years and review how grant funds have been spent. So this existed before some of the grants were, so it's really been sitting in either in the general fund. In my mind, it's just called the LAPC fund. I think on Kevin's side, it's called something else. So how you do it on the treasurer books is different than how I look at it, but that's where the money came from, and it's slated for emergency preparedness functions.
So this is something you planned on for quite a while.
To do this plan and to use money from here for something else. But as you know, I mean, we're talking about last few years, 21, we really started trying to get caught up on the plan. We're behind. We got behind, then COVID put us even further behind. So we've been working with the contractors to get up to the standard of all the other counties.
But who's on the committee, Dan?
The LEPC.
Yes.
So the LEPC, the chairman of that currently is Christy Moon from Public Health. I am the LEPC coordinator. The key county department heads are on it, as well as all tier 2 facilities in the county. The tier 2 are the hazardous materials facilities.
I guess what I'm asking is who's on there that has hazmat experience? And can we use this money to educate them so we can make up our own piles rather than paying an outside contractor to come in and draw up the plan for us?
And to Tom's point though, in our correspondence, you said that there's additional plans that have to be crafted.
Correct.
So are they all each gonna be an additional $25,000 for this?
They vary
Third-party
depending
contractor,
on,
correct?
they vary depending on what the consultants, think is gonna be the amount of time that's gonna be dedicated.
But there is gonna be an additional cost with the remaining plans that have to be drafted.
Correct, which are funded out of grant funds that we've been utilizing. We use the Homeland Security, grant as well as the, Emergency Management Performance Grant to fund the planning functions.
How long ago was Irene? 2011?
11.
And we haven't had a plan in place since.
Correct. We're trying, as I said, we've been behind. We're trying to get caught up. And actually, just to give you a little more history, in fact, in 2019, when myself and then the public health emergency preparedness person formulated a plan on how to get both the health side and us basically up to speed. However, COVID obviously pushed that aside. So we had started things, then everything kind of got squashed. So we use the state emergency management accreditation program as the standard to indicate what plans, and there's other things, but plans are our biggest thing that we need to do. So this is a standard that all the counties in the state try to adhere to. A lot of them are fully accredited. We are not yet, obviously. So we use that as a standard to look at what do we have to do. And so in this case, the debris management is next up.
So, not to beat you up on this, but, so if we approve this 25,000 for the debris management plan, what's left of grant money to cover the additional plans that have to be made? There's what, 3 more plans that have to be?
We got about 3 or 4. I don't know off the top of my head now what's, we have 2 in process now. Debris management is after that. And then there's a couple other smaller ones. None of them should be as large. They're much smaller. They're not as intense as debris management is, or the EOC operations plan. The comprehensive emergency management plan and the continuity of operations plans are also pretty large, involve many departments in the county. This is a more tactical level plan, and a lot of our other ones are more strategic. And, the highway department is the emergency support function lead entity for debris management, but that they're all emergency management plans. In order to have an emergency management program in the county, these are the list of plans you have to have. There's a set number of exercises we have to do. There's, community outreach functions that we have to do. There's numerous metrics that we have.
We get all 14 towns on board.
Well, for the majority, that is state backed off of all. They get 75%. Answer.
Anything else for me? Second. All in favor?
Aye.
Opposed?
Opposed.
I'm sorry if I answered.
O'Connell, you're not.
You're not
on the committee.
Oh, I'm sorry, apologize.
You can abstain like Charlie.
There you go.
Everybody's done that.
Huh?
Everybody's done that.
You think? He's good.
So that passed. Number 4, budget amendment and authorization purchase of one K-9 for the Greene County Sheriff's Office Department's K-9 program. Lennon, Martinez, Lanudo. It's quick. Handle.
Ready? I didn't hear you.
Who moved it?
Then
Martinez. No, Lennon moved it. Just
Lennon moved it.
I moved. Martinez
I
seconded.
guess the dog wants to know that everybody's supporting it.
Yeah, clarify that.
No one wants to get bit by the dog.
You go for it, Jim?
Can't make this shit up.
I found a new guy.
Haas is 8 years old.
I couldn't hear the word he said.
Thanks for the clarification.
Haas is 8 years old. He's gonna be 9.
Live to be 18.
Finance.
Yeah.
Where's the dog going?
David, did you get all that?
I have Lennon, Martinez, McCreek Handle.
Lanudo, Martinez, and Lanudo. And myself. All in favor?
Aye.
Opposed? That's carried. Anything else for public safety?
I'll entertain a motion for adjournment, Mr. Chairman.
I'll second that.
Ordinance and handle, we are closed.
What do you think, James? Another fine mess you